Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access and free to all at stepsforward.org.
Hello, and welcome to this episode in the AMA Steps Forward podcast series. I'm your host, Dr. Kevin Hopkins, a family medicine physician and senior physician advisor here at the AMA. Leadership. What comes to mind when you think about that? Leadership is vitally important in every aspect of life, and no less in the lives of healthcare organizations and our caregivers. How we learn about leadership varies. Our experience varies. Some of us are quote-unquote natural-born leaders, but for most of us, leadership qualities are learned and developed over time and with experience and with repetition of use. Here with me today as our guests to talk about leadership and leadership development are Dr. Karim Awad, who is a practicing sleep medicine physician and has experience in wellness program development for over the past 10 years. He's also a credentialed executive coach. Also, Dr. Diana Dill, a physician coach and consulting psychologist in independent practice in the Boston area. Dr. Awad, Dr. Dill, thank you so much for joining us today and for your willingness to share your expertise with our listeners.
Thank you so much, Kevin. So as Kevin mentioned, my name is Karim Awad. I'm a sleep medicine physician in the Boston area, and I've been working with Diana Dill for close to a decade, developing different programs, specifically also programs around leadership development.
Good morning. And I'm Diana Dill. I'm very pleased to be here today. I've been a consulting psychologist for many years, and since 2012, working specifically in healthcare to try to integrate some of the insights in psychology into practice of medicine to benefit physicians' wellness. And I've had the great pleasure of working with Karim to develop several programs over the past few years to address the burnout epidemic particularly.
Well, thank you both very much for helping us to understand a little bit more about who you are and your background. Quick question for you to start. Could you both sort of give us an idea of what you see as the value of leadership training and development, specifically in a healthcare environment?
Yeah, absolutely. That's a great question. We do see that there's a huge value in leadership because your leadership matters to the morale of your department and to ensure that things are working efficiently. So we do think that there's a lot of value in training leadership, and it is a teachable way of learning this. So this is something that can be easily taught, and chiefs and chairs can improve in terms of how they lead. You don't learn it or you don't come to it naturally. You have to sort of practice it and know exactly how to lead. And we do think that there's a lot of value in teaching that as well.
Yeah, nicely put, Karim. We've been really focusing on physician engagement as an antidote to burnout. And how can we promote physician engagement? We know physician engagement is critical for the well-being of both the individual physician and their organization. And we know that their direct supervisors have an outsized impact on how engaged physicians feel. There are leadership styles that lead to engagement, and there are leadership styles that suppress it without intending to, but nevertheless have the impact of suppressing engagement. Leadership styles can be learned across industries. Most managers or leaders never have formal training, so they're left improvising. What we've seen is that we can deliberately teach a leadership style that will help engage physicians, and we've developed effective ways to do it. So today we're going to talk about the value of collaborative leadership as a leadership style.
And we wanted to sort of role play, what is collaborative leadership? What does that even mean? And so just to kind of set it up, I am going to act as a clinician who's at the 25th percentile in productivity. And I need to be actually at the 50th percentile. And Diana is going to be the chief.
All right. Role play. I can't wait. Everybody loves it. You know, at every conference and meeting we do, as soon as you say we're going to role play, people roll their eyes and start to check their watches and their phones and, oh, they got to go to the bathroom all of a sudden. But I can't wait. This is going to be great. The Steps Forward Theater Steps Forward players. That's going to be fantastic. So I can't wait.
Well, thanks, Kevin. Thanks for your enthusiasm. I am shifting into my chief role, and Karim is one of my dedicated physicians. Karim, how are you today?
I'm good, Diana. I'm just a little busy. Got a lot of patients to see. What's up?
A busy day. Okay, a busy day. Well, if you have a minute now, I'd like to talk to you briefly, or we can arrange a time in the next day or two. Basically, our productivity stats for Q3 have come in, and I'd just like to discuss yours with you.
Yeah, I mean, a patient canceled now, but I'm happy to talk now. I've got a few minutes.
Great, great. Let's take a seat and just take a look at this. So, what you're seeing in this report is your productivity this quarter has been at the 25th percentile. And as you know, we're targeting the 50th percentile for all our clinicians. And I'd like to get your sense of what informs your productivity, what influences your productivity, and what would it take for us to start closing the gap?
Yeah, well, Diana, as you know, I see the more complicated patients in our group. They're very complex. I'm filling out disability forms. It's a tough panel of patients. So the organization should understand that I'm seeing very complicated patients.
Yeah, and we so value you're taking that on for our group. You are seeing our more complex patients in general. And at the same time, here we have these productivity targets. And I'm wondering if there's any part of the work you're doing that we can condense or find some other way of approaching so that you're freed up to do billing at a higher rate.
Yeah, well, I mean, it's like the paperwork. We're just getting so many pages and pages of paperwork, and here I am filling out like the patient demographics and their address. I mean, it's kind of ridiculous that I'm doing all this.
Mm-hmm. So you're ending up doing a lot of work that's not at the top of your license. What can you imagine might serve as a solution to that would allow you to be more freed up to do your clinical work?
I mean, I've had it once where Jackie, my medical assistant, helped me, and she was able to fill it out. I mean, it'd be awesome if she could just at least fill out like the demographics part. I mean, I can do the clinical part. If you can just do that, sort of the first part of that sheet, that would help me.
Okay. So you can imagine that having some admin support with the demographic paperwork would help you. And I'm wondering if there's also other ways Jackie could help that we haven't considered yet. But just looking at the demographic piece, what would it take to have her start doing that for you? And we could give it a try and see if it does help.
I mean, it's pretty basic. So I think she just, when the forms come in, she can tee it up for me. So maybe I can talk to Katie, the lead supervisor, and just maybe we can all sit together and try to figure out what the forms are and how she can help pre-fill it out.
Is that something you'd like to do?
Yeah, yeah, definitely.
Okay. So what kind of time frame would work for you?
I mean, if you give me, let's see, like 2 weeks to go through this with her and then try it.
Okay. And then what kind of time frame to test whether it's having the impact we hope it will on your productivity?
I would say if we give it a month, a full month would be reasonable because then you can have more data because there's a lot of variability, week to week.
Yeah, that sounds good. And it sounds like it ought to be doable for us. How can I help with this?
I think if you can tell Katie that this is going to come down, and that would be super helpful.
Happy to. I'll plan to talk to Katie today or tomorrow, and then you can plan to start working on this tomorrow. How's that sound?
Sounds great.
Okay.
All right. Well, thanks so much for the role playing here. And we wanted to just really emphasize a couple of things of what this collaborative leadership is. And we're going to come back to that point and sort of differentiate it from the more typical style of leadership that you might have encountered. But really, as you heard Diana do, she clearly showed understanding. She was asking questions. There was a lot about inquiry. She asked open-ended questions, and that's key. She also collaborated. This is so important in this. She didn't come in saying, here's the solution solution or you figure it out. No, she actually was asking, and let's kind of think about it. What do we do to sort of solve this? And that helps make the physician feel valued because their opinion matters, and they collaborate sort of to a solution as well.
Kareem, Diana, thank you. That was really cool. Good job. And I noticed the same things, Kareem, that you were, Diana, asking questions rather than telling him what he has to do or what he needs to do. You didn't use that type of language. The other thing I noticed is you didn't tell him that he was doing something wrong or that he was not doing a good job or not working hard enough. And because people get defensive when we come at them with that type of language or even just insinuating that, right? And so I think it got a different response from it.
Yeah, nice. Those are two key elements of collaborative leadership. The first, asking questions. The second thing you pointed out was that I was not judgmental. And in collaborative leadership, we assume that somebody wants to do a good job, and we try to find a way to ally around that. And so that was in the back of my mind as I didn't judge. I assumed that Kareem would, of course, want to meet his productivity targets or at least improve them. And maybe I could help him think through a way to do it.
Yeah, and I would just say that this is, the boss that you have and their leadership style really matters. And when we think about physician engagement and physician well-being, we really like to bucket it on sort of the work that you do. So, are you passionate about the work? Are you working at the top of your license? The life that you lead, meaning what's going on in your own personal life? Are there things that are draining you? Do you have a sick parent, sick child, whatever it might be? And then the boss that you have, and the boss that you have matters so much. And it's all about sort of what Diana mentioned, the core elements of collaborative leadership, which is starts with collaboration, as she mentioned as well. The second part is really understanding, meaning you come in and try to find out and understand the situation. And she already mentioned, Diana mentioned this, it's something we call expectancy. And that's really about thinking of the positive outcome, thinking that your clinician, your physician wants the best for himself and the department, and that you yourself as the leader expect a positive outcome out of it as well.
And then, therefore, the leader's job is to try to facilitate that happening, assuming that two pairs of eyes are better than one. How do we together come up with a solution?
Yeah, and I think it might be worthwhile to sort of contrast that to the other types of leadership. I think if we just do it very briefly, we can show you, what is the more classic type of leadership that you've encountered, and you can easily relate to this. So again, let's do a quick thing where I'm the clinician at the 25th percentile and Diana is the chief.
Okay. So we're going to contrast collaborative leadership with two more traditional styles. The first is the hierarchical top-down style, where only one person is making decisions. And the second happens way more often than we think it would, the hands-off style, where nobody is really making a decision because the leader is not playing a role to help it happen. Okay, so first we'll demonstrate hierarchical top-down directive style. Kareem, can you come into my office for a minute? We've just gotten your productivity ratings, and yours seriously have to improve. So come on in. I want to talk to you about this.
I'm kind of busy right now. I'm about to see a patient.
Yeah, this is pretty critical. They can wait. Come on in now. Okay, so compare this directive style to what you saw with the more collaborative style. How would you, the listener, feel being on the receiving end of this kind of management?
I've heard that interaction multiple times. I've probably sounded just like that, unfortunately, several times.
It's something we often default to if we're not on the top of our game or if we don't know what else to do, isn't it? It's a model that we have all around us. The trouble is, what's its impact going to be on your engagement if you're on the receiving end?
Yeah, it's clearly you didn't come across as valuing Kareem as a person or even the patient that he was about to see. And we know that there's a significant positive impact of people on our teams feeling valued. And when they feel devalued, it's very disengaging and doesn't bode well for their professional satisfaction or future.
Yep. So it has all kinds of ripple effects, doesn't it? Okay, let's compare the collaborative style in contrast to a hands off style of management. And I think we've all seen that where the manager, especially in medicine, I think managers are informed by not wanting to micromanage, but as a result, they default to not managing at all. I'm shifting into my chief's role. Kareem, we all got our productivity statistics today. What do you think of yours?
I mean, I think they're awesome given how complicated my patients are.
Uh huh. Okay. All right. How would you feel to be on the receiving end of that kind of managerial interaction?
Well, yeah, it was lack of direction to the conversation. I mean, really, the discussion ended. There wasn't a discussion. How do you feel? I feel great about it. Thanks. See you later. On with your day. So there was no message delivered, no message received. Probably both of those people would have walked away from that brief conversation with very different ideas of what exchange just happened.
Mm-hmm. And it would have felt awkward. Collaborative leadership, even though you saw it can be slightly more time consuming, is still the most effective form of leadership when we want to make sure our physicians are engaged. And as a consequence, we want to make sure that we're improving their culture and morale.
Culture, with an organization seems to be one of the primary drivers of clinician well-being or burnout for that matter within an organization, right? Some of the research that shows that a person's most proximal leader is the one that has the most impact on their overall professional satisfaction, sense of well-being, and engagement, right?
Yeah, I mean, exactly right. I mean, it's the adage that people say that you don't quit your work, you quit your boss. That's not obviously always the case, but that matters a lot. And as you know, Kevin, the Gallup has been looking at this for decades about engagement. And what they found, which was fascinating to us, is that an employee's engagement, 70% of that is determined by their leader. 70%. That is a huge amount. And there's definitely evidence to suggest that the more collaborative the culture is, the better it is for their organization's metrics, the profitability, the productivity, and being and sort of even individual well-being as well. And then the Mayo within looking in at healthcare itself, when they did their own scale, leadership scale, what they found is like 1 point increase in their leadership scale improves the department's burnout or reduces the department's burnout by 3%. And then it improves the department's satisfaction by 9%.
So, yeah, my next question for you was going to be, why should healthcare organizations even think about this or consider it? But you just answered it, right? So the return on investment, there's not much that we can do that we can invest in as a health system or health system leaders that is going to give a 3x return on that investment like this does.
That's right, Kevin. And in fact, this is the Mayo's and the Gallup studies are what inspired Kareem and I to start this program that we've run for the last 6 years. And we've shown that we can teach the chiefs to be more collaborative leaders. And we've shown not just a correlational study, but a change study. We've shown that as collaborative leadership increases, burnout and intent to leave decrease substantially, and work fulfillment increases substantially. So you're right. We've been looking for ways to improve the well-being of the physician workforce. Here's a really good way to do it. We've been looking for ways to keep our teams and retain our valued workers. Here's a very good way to do it. Moreover, it's not just an added burden of work for the frontline leaders, it's satisfying for them as well. We found that as our chiefs adopted collaborative leadership styles more and more, their own satisfaction went up and their own burnout went down.
So you mentioned, Diana, feeling valued, and I know I did earlier too. And we've seen this in our AMA organizational biopsy survey data that when folks answer questions about having a strong sense of feeling valued by their practice or organization, they're much less likely to leave that organization within the next couple of years. What are some key things that leaders can do that will convey the message to their direct reports and others that they are valued?
Yeah, I think that's a great question. And I think just to hammer away at this point, this is very much teachable, and the chiefs and chairs can start today and in doing so. And it really starts with inclusive decision making. And that's the collaboration, meaning that you are including your front line in helping solve the problem that is at hand, and not just coming in with either a hands-off approach, here's the problem, it's like a hot potato type of thing, or telling them, no, you're going to do this, X, Y, and Z. No, it's really a culture of collaboration.
Yeah, and a second really important thing that first line leaders can do today is start implementing really regular communication if they haven't done so already. Weekly team meetings, daily morning huddles, minimum monthly one-on-ones with their direct reports. Each meeting is a chance to build clinicians' engagement. You can listen to concerns, share updates, discuss ways to improve, and especially when first-line leaders share the airtime equally and encourage people to speak their minds, they will find their clinicians becoming more engaged.
And just to add to that as well, Kevin, you mentioned it a few times, is the idea of feeling valued. So it's that emotional connection, having your leader value you as not only as a contributing member, but as a human being too. I think that matters a huge amount.
Yeah, you're right. I mean, that helps you feel like you are a person. Nobody wants to be treated like a number. Our patients tell us that all the time. Well, physicians and other clinicians are really no different. I have had a leader in the past who every time I saw him, he called me by name, and he always asked about my family first by name and remembered specific details about names and ages and things like that. And that really meant a lot to me because it showed me that he knew me and cared about me as a person, not just as a family doctor who sees this many patients a year. So I heard you say things that we could start to do right away as a first line leader to begin fostering a more collaborative environment in our department or our work unit. I heard you say, Karim, starting with inclusive decision making, at least as much as possible. Diana, I'd heard you talk about regular feedback and regular conversation with our team. And then, Karim, I heard you talk about building emotional connections with our team that is going to strengthen our relationship for the long haul. So great first steps that we can take towards developing that type of culture. As we wrap up our conversation for today, what have I not asked that you'd like to make sure that you share with our audience? I know we're barely scratching the surface on this topic, but anything else that you think is key for us to include today?
Just to sort of anchor again on the points that we've made is that collaborative leadership is teachable and you can learn it, and you should put the effort in learning it because we think it matters a heck of a lot.
Well, thank you both. I've really appreciated and enjoyed our conversation and discussion, and I know our listeners will too. Dr. Karim Awad and Dr. Diana Dill have been our guests today talking about collaborative leadership, and I would encourage you to check out the tools and resources that are linked within the description of today's podcast episode. Included in that will be AMA Steps Forward materials, a playbook on wellness-centered leadership that was published in December of 2023 that talks about some of these very same principles and some very practical steps of how to adopt them into your day-to-day. And then I'll also point out a recently published playbook, The Value of Feeling Valued, was published on October 29th of 2024. And it talks about things that we can do as health system and practice leaders to convey the message that our people in our practices or organizations and on our teams are indeed valued, what demonstrates that, what engenders that feeling. So I encourage you to check that out too as a very valuable resource. So glad to be with you today, and thanks for listening to this episode. Until next time, stay well.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access and free to all at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.